Hello guys, or welcome to my channel. My name is Pere for those who are tuning in for the first time. So today I'm going to be sharing 5 tests you should be carrying out as diabetics. If you have been diagnosed as diabetes or you have somebody that is diagnosed as diabetes, there are 5 tests that you should carry out as diabetes. So let's get into this video. Please make sure to watch this video to the end if you are diabetes or if you are diabetic or you have somebody who is diabetic. Very important. And if you've not subscribed, Ejo, be cool. Please do make sure to subscribe before you keep on watching this video. Please, I'm begging you. So number one test you should carry out is your HbA1c. HbA1c, or like Kate said, hemoglobin. Now this test is like a test that gives you a review of how controlled your diabetes has been, how controlled your blood sugar level has been. So this test is usually carried out every 3 months. You should carry out this test every 3 months. So when you carry out this test, there is usually a number, a percent that is normal. Most of the time diabetics will target 6%. We target it for it to be 6%. When it's 6%, it shows that your diabetes has been well controlled. Your sugar level has been well controlled for the past 3 months. And if it's not well controlled, it will be higher. 7 is still, fairly controlled. When it becomes 8, 9, 10 and above, most of the time it's not. It shows that it is not well controlled and you need to take charge. You need to be doing your fasting blood sugar level daily. If you're not doing it daily, you need to be doing it daily. Get your glucometer, very important. Get a glucometer, so you're doing it daily. Watch out what you eat and things like that. So HbA1c, your glycated hemoglobin, is very important. Even if you're not doing any of the tests, glycated hemoglobin is very important for you to do every 3 months. Now, number 2, you have your renal function test. For those who don't know what renal means, it basically means your kidney. So it's like kidney function test. Now, one of the complications of diabetes, or one of the organs that diabetes tends to attack so much, is your kidneys. So kidney is very important. When your sugar level has not been well controlled for a period of time, your kidneys can stop functioning properly. You can have acute, and most of the time when you have acute kidney issues, sometimes they don't give you much signs until it's not chronic and irreversible most of the time. So it's good you always test your renal function test at least once a year, yearly at least. Please, very important that if you have any issue, you're able to detect it early and deal with it. So number 3 is your eye test. Now, diabetes can lead to retinopathy, that is false nerves growing in your eyes and then causing blood to leak into your eyeballs. So for kidneys, it causes nephropathy. For your eyes, it causes retinopathy, that is basically remembering your retinopathy, and with that can lead to severe eye issues. So one thing, and even blindness. So checking your eyes at least yearly is very important for diabetics. Check your eyes. There are tests. In fact, when you go to a good optometry place, be it an hospital or just somewhere that deals with eye, and you tell them you're diabetic and you need to do test, they know the test most of the time to do. And in Nigeria, yeah, there are only a few places who do those tests whereby they have to check behind your eyes, your eyeball behind. There are only a few places. I know in Delta State here, Lily Hospital, the Lily Hospital that does that. I don't know which other place. If you're in Ekiti, Abbott Multi-System Hospital does that. If you're in Lagos, I think there are a lot of hospitals that do that. You're in Abuja, there are a lot of people that do that. I think outside the country too, a lot of countries outside Nigeria have more access to healthcare. So sometimes it may be easier, just like the money. So that's why at least you try yearly to do it at least yearly, to check so that you can detect it early and solutions can be treated. So number 4 test you should do as a diabetic is liver function test. Now your liver function test most of the time to detect things like cholesterol, your cholesterol level and some other thing. There is a good cholesterol, there is a bad cholesterol. trying to use a layman language so that you understand more. There is a good cholesterol, there is a bad cholesterol. Once your bad cholesterol is on a high side, it can be so dangerous. It can make diabetic management very difficult. It can cause insulin resistance and things like that. Make your insulin not to work properly. It's good for you to do your liver function test, so you can also detect things wrong with your liver and treat it immediately. Treat it as soon as possible. Very, very important. Now, the last test I'm going to be talking about is your teeth. See, everybody, we know that everybody is supposed to do tests. Like your teeth is supposed to be cleaned at least every 6 months. Whether you're diabetic or not, every 6 months. And then now talking about diabetes, in case you don't know, I think it's not talked about a lot. Diabetes can affect, in fact, it affects the teeth, it attacks the teeth. Too much sugar in people can attack the teeth, causing problems, causing teeth disease, dental diseases, gum diseases. It can cause gum diseases. So checking your teeth regularly, at least a year, is very important. You can do it every 6 months. Good. Get your teeth cleaned, get your teeth polished. Good. But at least you do not have the resources for a try yearly to check your teeth. Very important. Very, very important. So you don't have to start dealing with teeth. See, the teeth issue is dangerous. So in case you don't know, a lot of people that take teeth, very likely, if you have teeth disease, if you have gum disease of the mouth, or whatever you want to call it can cause systemic infection. There's infection in your teeth, disease, and it can cause systemic infection. And when there's systemic infection, it's going to be an issue. So please try and also take care of your teeth. Very important. Now, aside this other test, these 5 tests that I have named, there are also some little tests which is going to be an addition that I'm going to add into this video. And number one, it's good to have a glucometer. Like I said, it's good to have a glucometer so you can check your sugar level, at least, if you have the resources, at least twice a day. Very important, morning and evening. Well, if you do not have the resources, at least once a day, once, like daily. And the best time to check it, if you're checking it daily, is your fasting blood sugar. That is very important. And also having a book where you record your fasting blood sugar daily is very important, so that when you're seeing your doctor, you can give that to your doctor, and if adjustment needs to be made with your insulin, your diet, or whatever, they can be made. Number 2 is your blood pressure. Also, if you have the resources, you can get a sphygmomanometer, which is your BP apparatus, and check your BP daily. Very important. Diabetes can affect your heart. That is very, very important. It can affect your heart. So important. Like normally when I was in the hospital, they used to tell me that diabetes and hypertension are like cousins. When you have one, you're at risk for the other one. Number 3, if you have neuropathy, like me, I have neuropathy. If you have neuropathy, one test you can do, which is not readily available in everywhere in Nigeria, but if you find yourself outside the country, or you find yourself in a place where it's readily available, it's good. So you have your nerve conductivity test. Nerve conductivity test shows how well there is flow, how well your nerves conduct. So because your nerves is what your brain uses to send signals to every other part of your body. So how well your nerve conducts those signals, how well your nerves are functioning, it helps to show. So please, nerve conductivity test, if you have the option of doing it, please do. It's very important. Do it. Number 4 addition is hormonal tests. Now, hormonal test is important. Diabetes can affect all your hormones, in case you don't know. For females, diabetes can cause things like, can put you at an higher risk of PCOS, imbalanced hormones, and things like that. For males, it can cause to be impotent, fact that sperm function and everything. So doing hormonal test can be good. It's good. So, but not compulsory. Not compulsory. Yeah, you don't have an issue, no problem. But if you have the resources, once in a while, you can just put that in. Important. So especially if you have the reproductive age, very important. So guys, I do hope this is helpful to people. Very, very helpful. So thank you so much guys for watching. I do hope that this helps somebody out there, give the right information to people so that they're able to manage their diabetic better and able to know what to do. So thank you so much guys for watching. If you have any question, please put it in the comment section below. If you want me to talk about anything concerning diabetes, mental health, and other health issues in general, please put in the comment section and I will make sure to reply as much and as soon as I can. Thank you so much for watching guys. Please make sure to subscribe if you've not subscribed, and I'll see you guys in my next video. I love you guys.